All right. Well, hi, you guys. It's Jenny on the block, and I am here today with a Dr. Aroumougame. Aroumougame? Did I do it right?
Correct.
Yes. Okay. And he's the Director of Medical Physics and Clinical Strategies for Radiation and Oncology. That is a very long title. So, can you tell us a little bit about what you do?
Well, I am actually with Summa Health Cancer Institute for the last 2+ years, going into three. I came in here as the chief medical physicist. I recently actually my responsibilities have somewhat added with a little more administrative stuff, supervising not just the medical physics staff, but the dosimetrists as well as the therapy team. And my responsibilities is not only to be clinical, but also actually provide administrative actually role in terms of development projects and quality improvements and accreditation and safety and quality, etc. I'm also actually part of the clinical trials that Summa Health Cancer Institute conducts and trying to help make sure our patients actually are timely enrolled in those clinical trials and basically comply with all the standards and make sure that everything is done very well.
Well, that sounds very important, obviously. And we love talking to Suma about all the things that they have going on. And today I know we're going to focus in on radiation as part of cancer treatment. So, can you tell me why radiation is used as a treatment for cancer?
Sure. Radiation actually is a physical agent which is used to destroy cancer cells. The radiation used is called ionizing radiation because it forms ions, which is charged actually particles, which deposits energy in the cells of the tissues it passes through. The actually energy that is deposited kills the cancer cells or cause genetic damage, resulting in cancer cell death. Now, the high energy actually radiation, such as X-rays or gamma rays, basically damage the genetic material, in this case, DNA, and cause actually block the ability for the cells to divide or proliferate further. Radiation actually damages not just the cancer cells, but also actually the normal cells. But the goal of radiation therapy is to maximize the dose to the cancer cells and minimize the dose to normal cells. Now, in comparison to cancer cells, normal cells have the ability to basically recover, repair faster, but actually not the cancer cells. So that actually makes radiation therapies all more actually important as far as the cancer treatment is concerned. Now, radiation can be used as an intent to cure, but also it is used as an effective modality for palliative treatments, basically helping patients to relieve symptoms from cancer care. So traditionally, radiation has been always actually given, for a long period of time, small doses, but those methods have been less accurate. But these days, we have made so much of actually developments in the area that we are able to allow as much normal tissues as we can. However, modulating the critical doses to those areas as minimally as possible or biologically tolerable while escalating actually dose to the cancer cells. So in summary, radiation actually kills cancer cells, shrinks the tumor, and relieves symptoms from cancer.
Wow. So it sounds like there are a lot of benefits to using radiation in cancer treatment. Now, I'm not sure if you kind of touched on this. What are the types of radiation? I thought when people say radiation, I just assumed there was one. Are there more than that?
Yeah, there are actually two main actually types of radiation therapy per se. Here's one is called the external beam radiation therapy. The other one is internal. External beam radiation therapy is most commonly used in many actually cancer programs. And the external beam radiation actually, both actually type of cancer treatments actually still actually kill the cancer cells. Now, external beam radiation therapy again is divided into many categories, such as it's called 3D conformal radiation therapy. What it does is it uses CT scans and computer software to create a 3D model of the tumor. Using this 3D model as a guide, the treatment machine actually directs radiation beams to the tumor and targets the cancer cells. So that is actually the 3D conformal radiation therapy. Now, a little bit advanced of the radiation conformal therapy is what is called IMRT, which is intensity modulated radiation therapy. The goal is the same, except actually we are now using beams of varying intensity to be able to escalate the dose to the tumor and still actually spare the healthy tissues.
Wow.
And that is the second thing. The third actually one is called arc-based radiation therapy. Is something similar to intensity modulated radiation therapy, but it is actually basically delivered in an arc-like pattern. That is another one. And then you can talk about image-guided radiation therapy. These days, what we do when we treat a patient, it is important that we precisely actually deliver the treatments. So we use actually from the machine a low dose X-ray or actually mini CT to be able to align the patient the way the patient was localized in terms of the tumor to actually accurately set up the patient and treat the patient. That is image-guided radiation therapy. Now, the recent advances are called stereotactic radiation surgery. Stereotactic radiation surgery is normally given in 1 to 3 fractions to actually cranial tumors, is high doses of radiation, very faster treatment, very precise treatment. Now, that is for actually cranial tumors. Now, you actually call stereotactic body radiotherapy. It is actually similar to stereotactic surgery, but it is outside of the brain, right? It applies to lung, breast, prostate, pancreas, spine, all those areas, liver, all those areas. And in both stereotactic radiosurgery and the stereotactic body radiotherapy, it's as precise as surgery can get, except it is non-invasive.
Wow.
And then, of course, we have particle therapy, which is instead of using X-rays or gamma rays, then we are actually now using actually protons. For some patients, protons are good because they deliver required radiation at the same time, spare the healthy tissues. And the other kind of external beam radiation therapy is also called intraoperative radiation therapy, which is normally delivered at the time of surgery. Basically, right after surgery, we actually do this intraoperative radiation therapy to be able to actually kill those cells that are still impossible to remove surgically. Okay, so these are external beam radiation therapy, different kinds of external beam radiation therapy. Now, the second major kind is called internal radiation therapy. It's divided into 2 categories, brachytherapy and systemic therapy. In brachytherapy, what we do is to actually put radiation either inside the tumor or adjacent to the tumor, right? We are able to selectively treat those areas. For example, cervix, uterus, prostate, and small tumors in head and neck, breast. So those are all areas where the radiation is delivered internally. And systemic radiation therapy, we also use radiation in the form of liquids. We inject this radiation in the blood, which seeks out to cancer actually cells and releases radiation and slowly kills them. It's also called radioimmunotherapy. So these are all actually, these are the 2 actually major type of internal radiation therapy. In brachytherapy, the treatment can be temporary, or it could be permanent. Oh. Temporary treatments are really actually shorter, within actually, the minutes, and it could be longer, maybe a couple of days. So those are actually, different type of radiation therapy treatments.
Got it. Now, do you guys ever use radiation in conjunction with other types of therapy?
Well, yeah, actually, the oncology care team basically determines when and how to include radiation therapy in the patient treatment plan, right? Radiation can be a primary treatment to shrink or destroy the cancer cells. It can be primary, totally independent of other options that are available. But it also actually used in combination with chemotherapy and immunotherapy, as I mentioned before. It is definitely used in combination with surgery. For example, before surgery, it's called a neoadjuvant therapy. It helps to shrink the cancerous actually tumor. And during actually surgery, I mentioned before, the intraoperative radiation therapy, during surgery and after surgery. Basically, it's also used basically because we wanted to destroy the remaining actually cancer cells, also called adjuvant therapy. The advantages of actual radiation is that it's not just used for cure, it is also used for relieving symptoms in patients, as we talked earlier. Now, radiation is also actually used to treat actually benign tumors, which are not cancerous. But the idea behind this is to relieve the symptoms again from those benign tumors.
Wow. Okay. And you kind of touched on some of the cancers that are being treated with radiation. Are there any specific types of cancer that really respond well, that stand out?
Yeah, I think radiation therapy can treat almost any type of cancer. Actually, whether a patient needs radiation therapy or actually the type of radiation therapy is all depends on the health and the type of the cancer, right? There are, Summa Cancer Institute, I mean, treats hundreds of type of actually cancers, and most of them actually qualify for radiation therapy. Some of the most ones we frequently treat here definitely are brain, breast, head and neck, lung, prostate, pancreas, liver, spine, GYN cancers. So we actually, and colon cancer, definitely. The center is known to be a center of excellence or accomplished, many actually great outcomes in treating these type of cancers.
Cool. Well, I wanted to also talk a little bit about advancements in radiation treatments in recent years, and kind of what SUMA is doing in the area of radiation, because SUMA obviously is always in the forefront. So I just wanted to get a little bit of an idea of where you guys are headed.
Sure. In terms of advancements, actually, radiation oncology is one of those unique specialties which actually combines medicine, fundamental science, biology, and physics, and technology. Now, recently supported by big data, artificial intelligence, machine language, and all those actually great tools to be able to have a really great perspective about where we need to go from here. And so the advancement in any of these areas that I mentioned definitely results in advancement in radiation oncology, right? The advancement is also about precision treatment, the speed of the treatment, and the outcomes associated with the treatment, the patient comfort level, and the comparative actually effectiveness of any treatment that is available for treating a given tumor, right? So I could actually say, again, recent years, I don't know how do you define actual recent years, but I mean, I can speak to actually some of the things that is really actually considered to be milestones in not only helping each practice to deliver to those patients. For example, being able to deliver accelerated treatments and hypofractionated treatments. For example, accelerated partial breast is one of them. It's not actually very old technology. It has been actually now become, standard practice in many places, and also advancing stereotactic body radiotherapy to other tumors, right? Sometimes actually, I mean, since precision is the name of the game, we want to make sure that, what is tried in one particular tumor is extended to other actually tumor sites as well. For example, we are treating a lot of lung cases. Now we are going to actually move into treating prostate, and slowly actually, we treat actually spine cases as well. But then there are other actually candidates in terms of tumors, such as actually pancreas and cardiac areas, right? And some of the development that is happening, one of the actually things that we hoping to do in the next few months is hyperarc delivery. Hyperarc delivery is you actually deliver everything from outside. So you're able to treat actually multiple lesions in one single treatment. You are able to treat multiple lesions in one, and that has never been, a standard practice in the past. The image-guided radiation therapy using MR, and again, MR-based linear accelerators are coming, the new advanced treatments. And the one exciting thing is biologically guided radiation therapy. You are able to diagnose actually cancer and treat at the same time. So it's not a two-step process. It's all happening one. It's called PET guided, positron emission tomography guided radiation therapy. Now, flash therapy is becoming also actually reality. Some national actually cancer institutes are really actually trying that. Proton has become a standard actually treatment option these days. And there is also actually a synthetic CT from MR. Instead of actually doing a CT and MR separate, you are able to do MR first, and then you get synthetic CT scans from MR scans, and therefore you are able to save money at the same time. Actually, you speed up the process. And the big data, as I mentioned, artificial intelligence, machine language, and automation have really advanced actually radiation oncology, and also lab studies in actually the tumor physiology, molecular biology, and the normal tissue radiation response. They're all advancing radiation oncology one way or the other. And of course, prospective clinical trials, comparative effectiveness research. One of the reasons actually interest is also disparative research. So both scientific as well as actually analysis of whatever is happening is feeding back into, I think, future advancements in radiation oncology.
Awesome. Well, I mean, this seems like radiation is really advanced in certain areas, at least in the recent times. And I wanted to let everyone know, if you need more information about Summa Health and their cancer care services, you guys can go to summahealth.org/cancer. Again, summahealth.org/cancer. Thank you so much for being here, doctor. And again, if you guys have questions, leave them in the comments or visit that website. Thanks so much.
Thank you very much. Yeah.